project Genstar was intended to focus on the gender sensitivity in the treatment and prevention services in Belgium. So in Flanders, the Brussels area and the Walloon area. We started from the hypothesis that treatment services have been developed by men for men, and we wanted to look at these services in terms of how gender sensitive are these services. There are two parts. So one research part, Genstar, identified the barriers and the facilitators for men and women to enter treatment, to stay in treatment. And then, and that will be the main focus of Julie's presentation, there is the project GenSon, which is focusing on actually improving the accessibility, this gender sensitivity in treatment and prevention services. Julie, are you ready?
Yes, I am. I hope you can all hear me. So as Wouter said, I will present in English as well. One of the objectives of Genstar was, as Wouter said, to identify how the lives of female substance users are constrained and supported by substance use treatment services. The research was structured in different work packs, and the findings I will present to you today are from the part that focus on the narratives and treatment experiences of female substance users and the part where experts were consulted. So through the help of several outpatient and residential alcohol and drug agencies in Belgium, we recruited a heterogeneous group of 16 female substance users who agreed to an in-depth interview. Also, we organized 4 brainstorm sessions to discuss the findings of these interviews. Again, here we aimed at heterogeneity in each session. So the participants in these brainstorm sessions were health workers from a range of different drug agencies, experts by experience, patients, and policymakers, both male and female participants, and younger and older people as well. So we identified 3 clusters of barriers and facilitators. One of the most important individual factors is parental authority. For female users with young children, the fear of losing custody of their children is a main barrier to treatment. So many women, even if they recognize the need for treatment, are reluctant to contact social services for help. Similarly, a few women who are already enrolled in treatment sometimes deliberately avoid being honest about their situation to counselors. So they occasionally omit reporting a relapse or certain events that might negatively influence their parental rights, such as, for example, selling drugs or hosting an acquainted substance user. In addition, some respondents who had already lost child custody gave up hope and did not see the point of ceasing substance use or seeking drug treatment anymore. However, some mothers in the study indicate that the fear of losing child custody, as well as recognizing the damaging consequences of parental substance use, motivates them to seek treatment. So receiving, for example, a final warning from social services regarding their parental rights serves for these mothers as a kind of wake-up call, and it motivates them to change their problem substance use and its related problems. So these mothers want to do everything they can to make things better, to change their situation and avoid losing child custody. Also, some participants who have already lost parental rights are encouraged to seek help or enter treatment, hoping to regain custody once they have completed the treatment program. So for some women, still having custody was a barrier, whereas for other women, it was a motivator. And also having lost custody before served as a barrier for some women and a motivator for other women. So this is a very important and two-folded factor that can work both ways. Yeah, you can keep this slide for a few minutes. Other individual factors are being aware of the problem use or not being aware of the problem use, a distorted image of what treatment actually is, how it is like, who is this for, and so on. Also, a certain vision and hope for the future and their family was for some women a motivator. And finally, feelings and emotions. Well, some women felt truly happy or proud when they didn't use for a few days, and that served as an eye-opener, a motivator. Other women used substances to avoid feelings because there was too much pain and trauma in the past, and they didn't want these feelings to pop up, so they continued using. In the second cluster, women report social stigma in private as well as professional contexts as a barrier to treatment. Participants describe how the stigma surrounding women with problem use is even more extensive compared to their male counterparts due to societal expectations and rules. The stories of the study participants reveal also that women have an extensive feeling of being responsible for family and children. Seeking and engaging in treatment challenges this role because it may jeopardize these responsibilities. Now, related to a woman's role as a primary caregiver, almost all female substance users report the lack of outpatient and residential facilities that provide childcare services as an important barrier to substance abuse treatment. Some women describe how waiting lists for treatment services may inhibit treatment entry because being confronted with a waiting list influences their motivation and hope in a negative way. When we look at the key concerns, we see that the narratives show different key concerns and needs regarding treatment. The themes regarding social stigma in relation to the recognition of specific female needs on the one hand and responsibilities of women conflicting with self-care on the other hand involve more global and societal concerns. In addition, 4 matters are revealed that relate to treatment features, such as, for example, a holistic approach or the importance of feeling safe in treatment. Women in outpatient and residential settings report to experience social stigma on women and substance use, which brings along a certain fragility and puts them in a vulnerable position. They say, I don't want them to see me as a woman. I want them to see me as a person, equally as to men. So we found that some women explicitly say that being a woman does not matter in alcohol and drug treatment or use. But on the other hand, we see that women in outpatient as well as residential settings say that they want to talk about certain topics such as sexuality, trauma, violence, abuse, children, or relationship. And they want to do that more than men and preferably with women because they understand them better. So, in that regard, implicitly, they say, well, yes, being a woman does matter, and women do have other specific needs. So there is an interesting area of conflict here, hindering female users in their recovery. The second global concern reported by the women in the study regards the responsibilities of women in society as an impediment to self-care. One major conflict that the narratives show is the roles and responsibilities a woman is assigned to by society and by herself on the one hand, and the need to take care of herself on the other hand. That's a very interesting one as well. Next to these societal concerns, 4 matters were revealed regarding treatment features. The first theme that popped up out of the data was the need to feel safe. Women reported in the interviews that feeling safe during their program was essential. They also give different meanings to that feeling safe. First of all, some women report to feel safe when there are no men in the program. Women also report to feel safe when there is a clear structure in the program and an extension in their life. And finally, women report to feel safe when there are no drugs in the program and anything that can relate to that from their past. So residential and alcohol and drug treatment programs should also ideally integrate a holistic approach, focusing on healing both body and mind. Something else that came up was a substantial number of respondents report that integrating an expert by experience in the program, more specifically a female expert by experience, would be of added value to their recovery process. Further, the advice and support by peers is also an important recommendation. And last but not least, there should be a mix of single gender initiatives and mixed gender initiatives in alcohol and drug treatment for women. Some women prefer single gender, others prefer mixed genders. There are pros and cons for every approach, but it's important that both are available for women. As a result of this study, we formulated 12 strategies and characteristics of gender-sensitive treatment for female users. First of all, 7 pillars are defined regarding strategies to successfully engage female users in treatment, such as applying a holistic approach, creating a safe, I think you're running a bit too fast, so it's give me some credit, such as applying a holistic approach, creating a safe and respectful environment, providing the possibility to build connections with peers and experts by experience, and empowering women in their care trajectory, but also awareness and availability of single and mixed gender services, organizing psychoeducational seminars, and addressing potentially sensitive and painful issues. Second, we identified 3 elements that account for women's unique treatment trajectories. First, a gender-sensitive approach in treatment often includes services that are more relevant to women than those provided for men. The overall style of such programs is more supportive, more nurturing and cooperative, focusing on specific issues. Second, it is essential to facilitate access to care and services for women. And third, due to a tremendous diversity in the background of female users, a gender-sensitive approach in treatment should be flexible and take into consideration the diverse family context of women's lives. Finally, 2 philosophies or approaches for delivering gender-sensitive services should be considered. First, the multidisciplinary integration and coordination of an area of services is promoted as a means for managing the multiple and complex problems of female users. The second approach stipulates that as female users are at various stages in their lives and in their substance use, gender-sensitive services for women should involve support for all women by adequately meeting their individual health and social needs without moral judgment. So the GenStar study was a scientific research project leading to many valuable results and a substantial report. But it did not lead to something concrete in the field, as in a change or an implementation or measures in the field of alcohol and drug treatment. So we wanted to do something concrete with results and found funding for a practice-based follow-up research project. During 3 to 4 years, we are now trying to give something back to the field by selecting and implementing a gender...
Julie, may I ask you to finish, please?
Yes.
1 minute.
Okay. So sorry. Okay, so I think we can just maybe very shortly introduce the 3 methods that we are implementing. So we are implementing trauma-sensitive yoga. What is this? This is developed at the Trauma Center in Brooklyn, Massachusetts. It's an empirically validated clinical intervention for complex trauma or chronic treatment-resistant PTSD. It focuses on the internal experience of people rather than the external experience. It's a shift in orientation from external to internal, and that's the key attribute of TCTSY as a complementary treatment for complex trauma. With this approach, the power resides within the individual, not within the TCTSY facilitator. And further, by focusing on the felt sense of the body to inform choice making, TCTSY allows participants to restore their connection of mind and body and cultivate a sense of agency that is often compromised as a result of trauma. This has its base in the trauma theory, the attachment theory, and neuroscience, and this will be implemented in a therapeutic community. The second method that will be implemented is seeking safety. It's a treatment manual in PTSD or trauma and substance use. It's empirically studied integrative treatment approach. It's the main topic of this method is actually that it wants to establish safety for women. So these are 25 specific units or topics addressing a range of different cognitive, behavioral, and interpersonal domains. Each topic provides highly practical tools and techniques to engage patients in treatment, to teach them safe coping skills, and to restore ideals that have been lost. And this will be implemented in the residential addiction unit of a psychiatric hospital and an outpatient aftercare initiative. And the last one that will be implemented is ACT, acceptance and commitment therapy. It's a form of cognitive behavioral therapy, a mindful approach to accepting the hardships in life to improve one's overall quality of life. And it focuses on the present and move forward from overwhelming, difficult emotions. This will be developed for Project. It's an outpatient service for female users, and it will be a gender-sensitive ACT group program. So the implementation will start in fall of this year, and we will evaluate it afterwards. So I'm looking very much forward to sharing with you these results.